Welcome to Brain Explained. In today's video, we will review surprising facts about mental health. You need only browse through TikTok to find everyone and their neighbor's dog declaring one mental health problem or the other. Sure, the increased awareness is a welcome, long overdue change. However, the amount of people feigning mental health issues for clout or self-diagnosing off of ridiculous symptoms has taken away attention from the real problem and created noise instead. As May is Mental Health Awareness Month, I thought I'd help clear up some of that noise and bring us back to the real issue. Come on, then let's review some facts. Statistics. Let's start with the numbers. Here are 5 surprising facts you didn't know about mental health. Around 20% of young people experiencing mental health condition, with 1 in 10 of them experiencing major depression at some point. Violence and mental health conditions don't necessarily go hand in hand. In fact, only a minority of people with severe mental health conditions, around 3 to 5%, show any signs of violence. Up to 800,000 people die from suicide across the world every year. In the United States, that number is somewhere around 41,000. Suicide is the second major cause of death globally in people aged 15 to 29. Half of all mental health conditions start by the age of 14, while 75% begin at age 24. Most people with mental health conditions do not try to seek help because of the stigma surrounding their condition. In fact, only 44% of adults get diagnosed with and treat mental health conditions. Stigma. What is this stigma I speak of? And why does it keep 65% of people with mental health conditions from getting the help they need? To understand why the effect of stigma is so strong, we have to break down what it means. Mental health stigma refers to the negative feelings and prepossessions we have about mental health conditions. Put simply, it's the disapproval, stereotypes, and shame that society places on people with these conditions. For example, people who experience depression might be called lazy or accused of faking for attention. Another example is thinking that people with anxiety are just neurotic or worrywarts. These are stereotypes that don't help their cause. Stigma doesn't just stop people from getting help, because even those who seek help are also stigmatized. A classic case of damned if you do, damned if you don't. It's why many people with mental health conditions don't seek help, because they don't want to be stigmatized as crazy or mentally unstable. Worse still, stigma puts pressure on people with mental health conditions. And this pressure can come from anywhere, like loved ones, colleagues, classmates, and even society at large. There's also the stigma one might attach to themselves for many reasons, like fitting in or not getting help. Finally, stigma can come from the condition itself. Wild as that sounds, mental health conditions may sometimes make people act outside of what is considered socially or culturally normal. This turns them into prime targets for hurtful beliefs and prepossessions. Stigma is neither a correct nor positive way of viewing other people's states of mind, as it can cause pain, worsen the spread of misinformation, and keep people from seeking much-needed help. We need more mental health awareness to deal with and eradicate stigma. Not only could it make their symptoms worse, but it could also delay or thwart recovery altogether. Never mind try and get help at all. According to the Mental Health Foundation, nearly 9 out of 10 people with a mental illness feel stigma and discrimination negatively impact their lives. They also state that those with a mental health issue are among the least likely of any group with a long-term health condition or disability to find work, be in long-term relationships, live in good housing, and be socially included in mainstream society. Causes. Given everything we know about mental health so far, the one thing that doesn't get enough time in the spotlight is the causes. Everyone knows someone who's experienced or is experiencing a mental health condition. But besides instances where it's clear what caused the condition, for others, it just seems to come in suddenly from out of the blue. So what causes or increases the risk of mental health conditions? Here are a few. Substance abuse, traumatic events, childhood neglect, abuse, or trauma. Social, environmental, and situational stressors, such as financial stress or losing a loved one to death, divorce, or imprisonment. Family history. Chronic medical conditions like dementia or diabetes. Early life adversity like homelessness, financial insecurity, and starvation. Acute medical conditions like a heart attack. Who is at risk? The risk level for mental health conditions differs based on several reasons like location, age, gender identity, sexuality, and race, among other things. Here are some at-risk groups. Young people between the ages of 18 and 25 in the United States experience more mental health conditions, about 36.2%. The next highest group is people aged 26 to 49 at 29%, and finally, people aged 50 and above come in last at 13.9%. In 2022, mental health conditions were more common in people with multiple ethnicities in the US, with 35.2% of them falling within this range. The rate of mental health conditions among other ethnic groups are Asian at 16.8%, Black at 19.7%, White at 24.6%, American Indian or Alaska Native at 19.6%, and Hispanic at 21.4%. When we look along gender lines, the numbers paint a depressing picture still. More than 1 in 5 women in the United States experienced mental health conditions in the past year. In fact, some mental health conditions are more common in women than men, such as bipolar disorder and depression. In fact, generally, women tend to experience mental health conditions more than men, with the numbers around 27.2% in women and 18.1% in men as of 2021. That doesn't mean men are coasting either. More than 6 million men in the US go through depression every year. During this phase, they will typically experience fatigue, feel worthless or sad, be more irritable, and have a sudden disinterest in work and other things. Screening your mental health. Now that we can identify mental health conditions, know what causes them, and understand that they can affect anyone regardless of class or creed, how can you protect yourself? The answer is knowing where to look. For that, these are 2 personal tests you can use to screen your mental health on your own. PHQ-9, GAD-7. The Patient Health Questionnaires, PHQ, and Generalized Anxiety Disorders, GAD, are questionnaires you answer to determine whether or not you have depression or anxiety. Both questionnaires also measure these conditions on a scale to tell you their severity. Now, this will not determine if you are or will be clinically diagnosed with a mental health condition, but it will let you know if it's time to seek help. Myth. With all the knowledge available now, you'd think that a subject like mental health would be free of misconceptions, but you'd be wrong. Much like stigmas, people still have wrong beliefs about mental health conditions based on outdated assumptions and old-fashioned thinking. For example, in the past, people with mental health conditions were believed to be possessed. Other times, their conditions are considered divine retribution. Granted, we no longer feel that way, but there are still myths that affect how we see mental health conditions. The key to overturning these myths is to provide more information. So here are 2 common myths about mental health conditions and why they are wrong. It's a sign of weakness. Life isn't a superhero movie where strengths and weaknesses define characters. Would it be considered a sign of weakness if you broke your arm? Much like a broken arm, mental health conditions are a medical problem, not signs that one cannot care for themselves or have poor character. That's why the cure for depression isn't be happy, any more than a broken arm can be fixed with a handshake. If anything, the opposite is true. It takes strength to live and function with a mental health condition. Mental health conditions cannot be prevented or treated. We already covered a list of possible reasons why people develop mental health conditions. However, what we also don't talk about enough is that these conditions are mostly treatable, whether with medication or therapy. Studies show that 70 to 90% of people who seek proper treatment for mental health disorders witness a significant reduction in symptoms. Understand that this doesn't mean mental health conditions are 100% curable, but they can be managed and people will recover to different degrees. What recovery means will also differ from one person to the next. Some might consider recovery as returning to their old life, when they were most comfortable. Others might view it as a present or future, where their symptoms have improved. The key message is that mental health conditions aren't death sentences, contrary to popular sentiments. I hope this video has been informative and improved your awareness of mental health conditions. If you like videos like this, don't forget to share, like, and subscribe. Thanks for watching.